Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. I want to wish you a happy new year, a happy 2023. Today is January 3rd, 2023, and I know a lot of you are sort of back to work and getting back into the routine. I also know a lot of you had respiratory viruses visit some of your holiday gatherings and you're getting over it. We are seeing a little bit of a downtick in some of those numbers, which is a good sign, but still at very high levels, and we'll talk details about that. As always, we continue to track all of our data. You can go to chi.gov/COVID- for the dashboard. You can go to chicago.gov/flu if you want to see what's happening with influenza. You can go to chicago.gov/monkeypox if you want to see what's happening with MPV or Mpox. But the bottom line is that all of these we continue to keep a very close eye on. We also, if folks have questions, we've been continuing to monitor the Ebola outbreak internationally. It's actually looking really good over in Uganda. They've gotten past the big part of the outbreak. We're through many incubation periods in terms of monitoring. We do continue to screen everybody arriving from Uganda at O'Hare. We follow folks for 3 weeks, but all of that has been behind the scenes and going well, and that's looking to be in good shape. So lots to be relatively thankful for from an infectious disease standpoint. I do, though, certainly continue to have some concerns about COVID, and I know some of you do too, because I've been getting lots of questions about variants. So as always, you can put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. And I invite you, as we're planning ahead over these next few weeks and months, let us know if there's topics that you would like us to focus on. We're going to continue in this new year to bring in guests to not talk just about infectious diseases, but about a number of the other issues that we work on at the Chicago Department of Public Health, bring in people from across Chicago who are working on health issues. So please feel free to drop it in the comments, send us an email if there's a topic you're especially interested in. We'll take about the first half of our time together to go through some data. I'll run through some slides, and then as always, we'll take your questions directly in the latter part of the hour. So let's start with the dashboard, chi.gov/COVID-. Given that it was a city holiday yesterday, we haven't had the update yet today, but it will be coming in. You can see, therefore, we have a little bit of a lag in terms of reported cases. But overall, not seeing a huge surge. Some of those numbers for hospitalizations are lower, partly because of that delay in reporting. But overall, I think the one that we continue to follow closely and that we do update every day is this hospital beds in use down in the bottom right. Still at just over 5%, 5.2% of our hospital beds in use. And if you want to come down here and click on hospital capacity, I just want to remind you, this is something that we are keeping a very, very close eye on. You can see it was last updated today, January 2. And if you want to look here, you can click down and see what's happening across the whole system. Across all Chicago hospitals right now, we have 334 people in non-ICU beds with COVID-19, and we have 19% of our acute ICU beds available. You can see the number of patients with COVID is up a bit here, but not seeing any huge spike like we've seen last year in January. So that is what I want to see. If we look at ICU, we've got 74 patients in Chicago beds, ICU beds with COVID right now, and 23% of our beds available. And then ventilators, we have 42 patients with COVID on ventilators, lots and lots of ventilator capacity. And the table at the beginning here gives you a sense overall of our capacity. And so if you look here, about 77% of our ICU beds are taken up no matter what they're taken up with. About 23% are available. And then in the non-ICU beds, about 81% are occupied, about 19% are available. And that's very, very good for us this time of year. So the folks in the hospitals are working hard. They're feeling that respiratory surge, but we are still doing fine in terms of overall hospital capacity, which remains my biggest concern. So that's good news overall. And let's go ahead and turn to just some slides here. Going to move into the beginning. So first of all, with New Year's, we continued to lift up from a mental health and substance use standpoint the messaging that it's okay to not be okay during the holidays. I know for a lot of people, holidays are a time of joy and gathering, and for a lot of people, they can be a really difficult time of people feeling lonely or people feeling like they haven't achieved things that they wanted to achieve. Often when the days are the shortest, people who have some seasonal component with the light can have more problems with seasonal affective disorder and depression. And then as we come out of the holidays, that can also be a time of more stress and more issues with mental illness for some people. And so I just wanted to remind you that if you or someone you know needs support, you can reach out. You do not need to be the person experiencing a mental health concern to use these resources. You can also call and get advice about how to talk to somebody. There is a nationwide mental health crisis number, 988, that launched last year. In the same way you can call 911 anywhere in the country for an emergency, you can call 988. There's been work to roll the various suicide hotlines into that number. You can call 24/7. It's available in multiple languages. So 988 is your new nationwide mental health crisis number. And then closer to home here in Chicago, I encourage you to visit mentalhealth.chicago.gov. We are putting a lot of information up there. There's information about Chicagoans, how we are trying to turn mental health into something we talk about, not something that goes unspoken. There are resources there for how you can find clinical appointments, even if you're uninsured, even if you don't have documentation. You can also talk to a live mental health professional here in Chicago through the NAMI helpline at 1-833-626-4244. We have immediate opioid treatment available through the state's crisis opioid line, and then a number of good online support groups. You can see a space for women and non-binary people who are in recovery. There's a medication-assisted recovery anonymous groups. Those are especially for people who are receiving treatment for opioid use disorder, and other harm reduction meetings and support groups. This is just a sample of some of what's available. We also were lifting up and continue to just remind you of the basics as we think about staying safe from COVID-19 in the new year, heading into the third year of COVID-19 being part of our lives. And the basics haven't changed. Vax up, mask up, back up, open up, wash up, and test up. And find your vaccine, as always, at chicago.gov/COVIDvax. Let's get into some of the data. So nationally, the influenza season is still going very strong. I'm sure a lot of you know someone who's been diagnosed with flu officially in the last few weeks. And when we say flu, we really mean influenza. That is a specific virus. It usually gives people significant fevers and this feeling like you've been hit by a truck, along with the cold symptoms and the cough symptoms and the runny nose. So typically, if people are having fever, it's more likely that they're having COVID or they're having influenza, whereas if you're not having a fever, it's more likely that you're just having one of the other respiratory viruses that are circulating. But I want people taking a COVID test, even if they don't have a fever, if you've got new symptoms, because it's important that you're getting diagnosed to help prevent the spread and to help make sure you're getting treatment. And if you're someone older or at higher risk, you're really not doing well, getting an influenza test also in the same way you can take the medication that can help keep you out of the hospital. So you can see across almost the whole country, influenza-like activity level is high, including here in Illinois. And here in Chicago, this is off our own dashboard. chi.gov/flu is the short version, or you see the long version at the bottom there. Activity does remain high. This season, just since October 2 of 2022, we've had 156 Chicagoans admitted not just to the hospital, but to the intensive care unit with influenza, meaning they're typically needing some kind of respiratory support. They're needing to have a tube down their throat to help them breathe, or a lot of extra attention because they're they're really sick and at high risk for dying. I also want to emphasize that we do continue to see children here in Chicago, in Illinois, and across the country getting really sick with influenza. That's different than COVID. Thankfully, it's quite rare for young children to get seriously ill to the point where they need to be hospitalized or die from COVID, although it can happen. It happens much more frequently with influenza. And so this season, across the country, already more than 61 children have died from influenza, and 3 in Illinois alone. Now, those numbers are low compared to the number of children in the U.S., but they are much higher than we see for COVID, and we have seen for COVID. And just reiterating, getting children, especially young children, that flu shot is critical. If your child does get flu, you don't want them ending up in the hospital. You don't want them, running the risk of even potentially that tragedy of dying. And we are seeing fewer children getting their flu shots in Chicago. We're seeing the number of adults on par or even ahead of where we were last year for flu shots, but the number of kids up to date with their flu vaccines is down, and that's not good news. Across the U.S., on the left there, that line, the black line with the red triangles, shows us the current season. And this is outpatient visits, meaning people going to their doctor's office, going to urgent care, going to their pediatrician for influenza-like illness. And when we say influenza-like illness, these are people coming in with a fever and a cough or a sore throat. Good chance that they probably have influenza, but we don't have a lab-confirmed test yet. So this is called syndromic surveillance, where we're monitoring a syndrome, a type of infections that come together. We also do lots of testing, and you can see it on our dashboard, of actual flu tests here in Chicago. But this is a very quick way to monitor what's happening. And we're seeing a lot more outpatient visits, as you can see, than are typical for this time in the year. Same thing in Chicago. That dash line shows kind of our threshold for when we see a threshold of concern, meaning more than 2% of the folks who are coming in are actually testing positive. And you can see that red line for 2022, 2023 is higher than we've seen in a number of years. That purple line, 2019 to 2020, that was the beginning of COVID, and then since then we've not seen a lot of flu season, but it is definitely back here in Chicago. And if we look at emergency department visits for, again, influenza-like illness, they are high. The good news is in the pink line there, they're decreasing for our very youngest Chicagoans, 0 to 4, but they're still much higher than they've been previously, and they remain high for those age 5 to 17. So get your kid your flu shot, have people wear a mask, kids wear a mask. If you're not feeling well, try not to spread it. There's a lot of flu going around right now. So on the COVID front, happy to say we remain at a medium COVID level. Across the whole country, we've seen this with every holiday. We often will see a little bit of a dip in testing. People will often delay seeking care. A lot of the outpatient laboratories may not be operating on full schedules. And so it's really the people who are very critically ill who are more likely to come in and get care around the holidays. And so typically we do see some rebound of that along with seeing the effect of potential gatherings. So good news is we're still at medium. I would be very happy to see us avoid high, but I do think we will likely get there after, in this sort of post-holiday time period, but time will tell. This is looking pretty good. And as a reminder, if we reached a high COVID community level, we would issue a formal mask advisory, but we are not at a high level yet at this point. And last week, 9% of U.S. counties were at a high COVID level in orange, and 40% were at a medium level. That is actually down a little bit. Again, some of that is just expected with some changing in testing behavior around the holidays. So let's talk about variants. This is what we continue to get the most questions about. So in the Midwest here, just as a reminder, each of these vertical lines is a week. So on the furthest left there, you're seeing the week that ended October 1st, and then the week on the right just ended December 31st. And what we continue to see is more infectious Omicron subvariants emerging. You can see right now in turquoise there, BQ 1.1, BQ 0.1. Those are the bulk of what we are seeing here in Chicago and in the Midwest. That purple up top, it's XBB 0.1.5 is about 6% right now, but it has been growing pretty quickly. And if we look across the U.S., that XBB 0.1.5, that purple, you can see up in the Northeast is well over 3/4 of the infections right now. That's probably some of what's driving the little surge that they're seeing in the Northeast. New York City's been at a high level. And so certainly one of the things that our scientists here in Chicago are keeping a close eye on is that new variant. That is still Omicron, I want to emphasize. But every time we see a new subvariant emerge, it's a little bit better at evading some of our own immunity. And I wanted to just pull up one picture explaining a little bit about this, and I'm happy to take questions. This is from a recent paper, December 13 in Cell, which is a very good article. And this is just a basic chart showing what has happened with the evolution of the evolution of COVID, SARS-CoV-2, the virus that causes COVID over time. So do you see on the left here, all of this in gray? These are the original versions of SARS-CoV-2, the virus that causes COVID. WA1, that's the official scientific name for the original COVID-19. And the way that these charts work, the further you are from that WA1, the more genetic distance you have, the more different the variant or subvariant is. So you can see that they've labeled these different clusters, alpha, gamma, delta, beta. In each of these cases, when you get enough of a change, you get enough of a mutation in the virus that it's different enough, that's when it gets labeled a variant of concern. That's when it gets one of these names, alpha, beta, gamma, delta, Omicron. Everything circled in yellow here is Omicron. And this is all the changes that we've seen over approximately the last year. And so the further away one of these little dots is, the more different it is from the original COVID, and the more different it is in ways that are making a difference clinically. The virus is spreading much faster, the virus is making people sicker, etc. And so you can see that over on the right here, all of these different colors, these are all the different subvariants of Omicron. And on the furthest right, in green and then in red, see how these are the furthest away from where WA1, the original SARS-CoV-2 was, meaning they're the most sort of resistant, the most different SARS-CoV-2 variants to date, and specifically XBB and XBB1, and then BQ1, BQ 1.1. The good news is they are all still Omicron. I would worry the most if we saw a new offshooting, something like that red dotted line. We haven't seen that, but if we saw a new variant of concern that was so different from Omicron, that's when you'd really worry the most that there's been a major shift. The vaccines might not be as effective, the treatments might not be as effective. So that would be the thing we would worry about the most. And if one of these new subvariants turned out to be different enough that the scientists decided it needed a new name, a new variant of concern, that's when I would really, that's when I would be raising the alarm the most. But in the meantime, this XBB, which again, just as a reminder, going back here a second, that purple there, that XBB 0.1, XBB 0.1.5, that is really spreading quickly, especially in the Northeast, that is down in the light blue here. And it's just a recombinant, meaning a fusion of two different BA2 variants. So see how we had a lot of BA2 there in yellow? This is kind of a new version from BA2. And what is most notable, and what hasn't gotten as much attention, but I do think is worth noting, is that on the good side, we haven't seen a new, the next letter of the alphabet is pi. Sometimes they would probably skip pi because it has the potential to confuse people because pi means other things. But we haven't had a new variant of concern yet. But I will tell you that as this virus continues to mutate, what we have seen is that all of what are called our monoclonal antibodies, our clinical monoclonal antibodies, are inactive against these most recent subvariants. And the monoclonal antibodies are these IV infusions that people with really severe immunocompromise will often take. People who have a organ transplant, for example, and the vaccine doesn't work very well because their whole immune system has been tamped down. And even though they take the vaccine, it's safe, they don't mount enough of an immune response. And so we've historically used what's called a monoclonal antibody, which helps give them passive protection. But the problem is that as these new subvariants have gotten further and further from the original, the word monoclonal literally means single clone. It makes one antibody, and those antibodies just are no longer, the virus has figured out how to mutate around them. So we have lost most of that monoclonal antibody treatment. And so some of you have been asking, what are we worried about? My biggest worry is that a new variant of concern always, but also that we have to keep up, like the science has to keep up. We're going to likely have to keep updating vaccines annually. The good news is Paxlovid continues to work very, very well, including against all of these subvariants. And thankfully, the vaccine continues to protect against severe outcomes. But we've updated the vaccine to match these new subvariants more. We're likely going to have to do that. There's a good chance we may need to update the antivirals at some point. And we've already lost the monoclonal antibodies that have been helping to keep some of our most vulnerable people safe. And so just as the virus continues to mutate, even if it's not top of mind, it doesn't need to be top of mind. We do need to invest in staying ahead of it from a science perspective. And so I will just remind you again that since the Omicron variant became dominant in Chicago, unvaccinated Chicagoans, in red here, have been almost 3 times as likely to be hospitalized with COVID than up to date, meaning vaccinated and boosted Chicagoans. And I want to keep our line dark blue here. The higher is worse. This is showing how many Chicagoans are getting hospitalized. You can see that big surge last January when Omicron hit, that the red line, those who are unvaccinated, so much more likely to be hospitalized. But you see there was a big difference last January in the light blue line, meaning those who had had their original vaccine, and then the dark blue, those who had been boosted. And that has persisted, and that has persisted through this most recent booster. So getting your up-to-date vaccine is important. There are, remember, new COVID-19 vaccines that became available just after Labor Day. They're now available for everyone 6 months and up. They give you the strongest protection. They help protect against those variants over on the far right there. If you got your original vaccine, that vaccine was designed for WA1. It was designed for the original COVID virus and the SARS-CoV-2 virus. And we've just seen a lot of change since then. You getting your updated booster gives you that protection for all of the activity that's going on the right. And so check your vaccine card. If it's been more than 2 months since your last vaccine, almost certainly you need the new booster, everybody age 6 and up. A few other just quick reminders is that we are still very much operating our chicago.gov/at-home vaccine program. We will bring vaccine to you if you live in the city of Chicago, free of charge, no questions asked. We'll bring you your first dose, your second dose, your booster dose of COVID vaccines. We will bring it for everybody age 6 months and up. And as long as at least one person in your group, and we'll do up to 10 people, is getting a COVID vaccine, we'll also bring everybody up to date with flu. We have appointments Saturdays, Sundays, weekdays, mornings, afternoons, evenings. Call us at 312-746-4835 or schedule your appointment at chicago.gov/at-home. I know sometimes it's like, I don't know which one to get and which pharmacy and where do I go. We will bring it to you. I also just want to remind you in the new year of a few things to take advantage of if you have not done that yet. There's another free round of at-home COVID-19 tests available. Go to covidtest.gov, put in your contact and shipping info, and place your order. It's free. You do not get charged for shipping. You do not get charged at all. If you don't have internet or you know someone who doesn't have internet, they can call 1-800-232-0233. Many places are also distributing free COVID tests. I want you to have COVID tests at home ahead of when you might get symptoms. And just a reminder, because there's a lot of COVID going around, if you do catch COVID-19, nothing has changed. Regardless of your vaccination status, you must stay home for 5 days. If you're feeling better after day 5, you can leave your house, but you must mask from days 6 through 10. And then just another reminder, Vax and Pax, that's what I want people thinking of. If you test positive for COVID and you're more likely to get very sick, treatments, especially Paxlovid, that's the oral medication, they are available and they're effective, but you got to start within 5 days of when you first develop symptoms. Paxlovid's available for anyone 12 and up who weighs at least 88 pounds, and it's really designed for folks who have mild to moderate COVID but are at high risk for developing severe illness. So if you're over 50, especially if you're over 65, I would strongly recommend taking this. If you have underlying conditions, talk to your doctor. And there are people who are taking medications that, can interact. There's an IV medication called remdesivir that we're also using. But if you don't have a healthcare provider, you can go to a test to treat location. You can find it on our website, or you can give us a call. And a few just last reminders. Wear the mask right. I was pleased to see on the L this morning coming into work, seeing a lot of folks wearing masks. That's good, especially after the holidays now, knowing that a lot of people have been traveling and gathering. I like seeing folks just popping that mask on in settings where the risk, where you're just around more people you may not know. So, I know you know this, but it's just worth reminding. Wearing a mask correctly is important for it to be effective. The KN95s are going to give you the most protection, but having it on is the most important thing. Under your chin, snug around your face, up to the bridge of your nose. Not wearing it loosely, not wearing it under your chin, not just covering the tip, and try not to leave your nose and chin exposed. And then I also just wanted to highlight, we lifted some of this up over the holidays, but I think it's worth just reminding you of a few easy things that you can do all the time to make the air in your home safer during COVID. But this also makes it safer during flu and safer during respiratory virus. We want to reduce the level of infectious particles that are in the air. So the easiest is just to bring a little fresh air into your home. Open your windows and your doors in bad weather, even just opening them for a few minutes every hour really has been scientifically shown to reduce how many infectious disease particles you're seeing in the air. You can turn on exhaust fans in your kitchen and in your bathroom. If you've got visitors in, put them on and have them on for 1 hour after they leave. You can use fans. That helps improve airflow. Again, turning a fan on when you have visitors and for 1 hour after they leave. All of this helps reduce the concentration of infectious particles. And then if you want to get a little more involved, consider an air filtration system. There are these portable HEPA air cleaners. You want to get one that's appropriate to the size of the room, and it kind of creates a do-it-yourself portable air cleaner. Finally, if you do have air conditioning, you can set your HVAC fan to on, not to auto, but to on when you have visitors. So that's not turning on the air conditioner, but it's turning on that fan within your home. You can use higher efficiency pleated filters that fit. You should change those filters every 3 months. There's a lot more information from CDC, from EPA, and from CDPH online if you want to read a little bit more about this. But these are easy things that you can do, and I encourage you to do if you've got folks over, just to help keep that risk down in case somebody does have COVID. And then finally, I do just want to highlight CDC recognized CDPH for something called Project First Line. Project First Line is the CDC's national training program for healthcare infection. If we train healthcare workers to use good practices for infection control, it helps protect them not just against COVID or monkeypox, but against an emerging or an unknown disease. And so here in Chicago, our CDPH healthcare settings team, they proactively created online online interactive trainings around monkeypox, which is now called Mpox, or we were calling it MPV, to really help train folks. How do I care? What do I put on? Train more than 200 healthcare workers, and not just here's what to do, but here's what we saw locally for monkeypox. Here's how you can think about keeping yourself safe and keeping your patients safe for healthcare workers. So congrats to our healthcare settings team. And as always, if you need a vaccine or a booster, you have questions, you can call chi.gov/COVIDvax or 312-746-4835. And with that, I will go ahead and turn to your questions. And right off the bat, yes, we are still doing clinics. So we have continued to extend our clinics into January and into February with the city colleges. So we are operating this Saturday, and if you go online, we know a lot of people have really liked that as a place to get their COVID vaccine and get their flu vaccine. So yes, we are still operating those. All right, let me switch here. Okay, so a couple of questions here about China, which I share your interest in. So let's talk about those. Mary Rodriguez, for example, on Facebook says, are there any new variants that are being monitored with the outbreak in China? So for those of you who might not be following, and a couple people are asking, how concerned are you about China? So China, just in the past few weeks, really made a pretty abrupt shift in how they are thinking about COVID control. China has had probably the strictest COVID protocols in the world to date, really a zero COVID goal, where they were testing millions of people for COVID. They were regularly locking down cities if they were seeing even a little bit of an increase in COVID cases. But the problem is that really is not sustainable in a long-term, many years kind of way. It makes sense, certainly early in COVID. They've had, prior to this, incredibly low rates of hospitalization and death, but they also have not been able to have borders open. They've had a lot of restrictions, and there was not a great plan necessarily for how to get out of this. So what's interesting is that there were some protests in China, which is pretty unusual, around this policy. There was a fire that happened where there was a belief that some of the reason that people died in the fire is they were under isolation, government required isolation and quarantine. I don't know how true that is, but really seeing some protests, which is highly unusual. And within the space of about a week and a half, the decision was made to shift from a zero COVID policy to really a policy of openness around COVID. The government has stopped testing largely, has stopped reporting hospitalizations, has stopped reporting cases, but the epidemiologists and the doctors, sort of outside of official government reports, have noted that, not surprisingly, in a country that has not seen a lot of COVID to date, there are cities where as many as 1 in 5 people are testing positive or are positive for COVID all at the same time. And they are clearly breaking records, not in a good way, for both hospitalizations and, crematoriums, deaths, et cetera. It's hard to know exactly what the situation is because there are not sort of official government numbers. But the worry is that a very restrictive policy makes sense to buy you time to get everybody vaccinated, to get the good treatments, the Paxlovid equivalent in place to build up your hospital settings. But unfortunately, there are a lot of especially older Chinese that are actually not fully vaccinated and up to date, and the Sinovac is not as effective, it looks like, in the trials, is not as protective. And so there's a lot of worry about how many hospitalizations and deaths are likely to be seen in China, and a lot of worry there. Secondarily, of course, just with a lot of COVID spreading right now, that yes, there is some risk for variants, and Mary, I'll get back to your question, but also just knowing that it's a major surge right now, the risk for travelers either direction would be higher right now. And so the U.S., along with many other countries, has said as of January 5th, if you're coming from China, you need to show a negative PCR COVID test within 2 days of travel to the U.S. to be able to leave China. And this was a policy, that was in place across the whole world earlier in COVID, but had been dropped. But it has been put back in place, I expect in a temporary way as we get through this surge. That is not going to stop transmission of COVID, just to be clear. It will probably slow it a little bit, probably by estimate. You probably drop, 10%. It's not nothing. But that will be in place. So just for anybody who's traveling to or from China, know that you need to have a negative COVID test to be able to enter the U.S. And in terms of new variants, we've not seen new variants yet, but there also are some concerns with so much transmission. My biggest worry is that it's a good setup for the emergence of variants, and there's some worry that the official kind of variant surveillance has also been taken down because the testing has largely been taken down by the central Chinese government. And so again, there's work that's happening, and we do know that most of what's been circulating, at least that is being tested, is not a new variant. It's actually, it's one of the Omicron subvariants, but not even the most recent ones. But we have stepped up in the U.S., for example. There's some screening that's done at airports, voluntary, where people get a swab and it's pulled to look for variants. We also at O'Hare, for example, we continue to monitor wastewater, specifically at O'Hare. We have the ability when we detect COVID to look for subvariants and variants there. This is not a way of tying it to an individual, to be clear, but it is a way to just monitor for the emergence of potential new subvariants. And I think it is really important that we continue to do that kind of laboratory surveillance work. So I'm not concerned at this point about new variants, but I am concerned about the potential. And mostly I'm just worried, as I would be here, if we were having a significant surge and we had a lot of older Americans that were perhaps not fully up to date with their vaccines and didn't have access to the testing or some of that early treatment. So time will tell, but we are keeping a close eye on it. Okay, so not surprisingly, a number of questions about variants, and that is what I know a lot of you have been wondering. So let me just read through a few of these. Alexandria Deanne on Facebook is wondering, what is the XBB 1.5 variant? I'm hearing it's causing more severe cases. Is that true? So the reason that I pulled up that slide a few minutes ago was to sort of describe that XBB 1.5 variant. It's basically just a combination of two of the earlier subtype 2 variants. It is not at this point clearly showing more severe cases. They are seeing some increase in hospitalizations in older folks in the Northeast, but that seems to be, at least based on what I'm reading and hearing from folks, that seems to be based as much on the fact that they're seeing just a surge overall. This is clearly a more infectious subvariant, meaning it's spreading more easily. It's out-competing the other variants. That's why in that map you see about 3/4 of the variants are that new subvariant. And so with that increase, it seems like we're just seeing more older people get infected, and if they're not up to date, especially with their vaccines, they are somewhat more likely to be hospitalized. But no, I haven't seen anything suggesting that this new subvariant is clearly making people sicker. I think we'll learn more as we follow, and if we see if this turns into a significant surge, if it moves across the country. It's still sort of in the early days. Remember, though, it's all still Omicron. I would have the biggest concern by far, and I know I say this a lot, but it's a variant. It's in that variant of interest category. We label it, we monitor it, we give it those alphabet soup of letters to be able to keep track of it. But the big worry is if we see something emerge and grow to be a new variant of concern, meaning it gets a new letter in the Greek alphabet. We haven't had one of those in a year. I hope we never have one again. But no, I'm not hearing it's causing more severe cases, although we're keeping a close eye on it. Okay, and then Mike Chinnander from Facebook. Interesting questions. Does this new emerging subvariant cause more or less severe disease, more or less severe illness than previous subvariants? So like I just said to Alexandria, we're not seeing a clear difference in terms of illness. We are seeing that, like I mentioned, we have completely lost one of the treatments that we use to help prevent disease for really immunocompromised people. We've lost those monoclonal antibodies, but other than that, we're not seeing it at this point cause a significantly different illness. Omicron overall, by the way, still like infection for infection causes less severe illness than, say, Delta did early on. But some of that is probably related to, everybody basically either through vaccine or infection or both in the US has some level of that immune protection. So, and then he also asked, what's the significance of it starting with an X instead of a B, instead of like the previous Omicron subvariants? Yes, so there is, like I said, kind of this alphabet soup. If you get a sort of a cross reactivity of two different kind of subvariants or a recombinant, sometimes you'll see that X being used. Again, I wouldn't read a whole lot into kind of the X's and the B's and the B5s. Look, the reason I show you the maps I show you, look for the colorful ones. The ones that are growing, and on that national map, that's where we could see that purple was this new subvariant. If you're seeing that grow, you know that it is more contagious by definition. It is out-competing. You don't know from that if it's making people sicker. That's where you look at hospitalization numbers. But the good news is that although like the New York area has seen an increase, they're not being overwhelmed. It's not looking like when Omicron first hit us, for example. And then DS Shin on Facebook is asking, are there any new symptoms of COVID to watch for, especially with the new subvariant rising? Nope. So COVID is showing up very much like it already has. I think if anything, we are seeing it a little bit less likely to have the more severe symptoms. Definitely people get the severe symptoms still, especially if they're not up to date with their vaccines. But more often now, we are seeing people, especially if they've fully up to date, maybe it's their second time getting COVID, whatever it might be. We're seeing more people actually just have cold-like symptoms, less likely to have those flu-like, really feeling very sick. The high fevers are a little less likely to happen than they were over on, but they can happen. We're also seeing a little bit less of the loss of the taste and smell than we did earlier on. It still can happen. It's still what we call pretty pathognomonic. That's a fancy medical term for if you see this particular symptom. Pathognomonic means it pretty much is that disease. Like there's not a whole lot of things. There are a few other things, but there's not a whole lot of other things that give you a loss of taste or smell. So if you get a loss of taste or smell and you've got other symptoms, there's a very good chance it's COVID. But most people with COVID don't get a loss of taste or smell. We're also seeing fewer people being newly diagnosed with long COVID, although we still are seeing people. A lot of that long COVID seems to be from earlier on. And the vaccines do seem to have helped with that as well. So another good reason in terms of people say, why do I want to stay up to date with my vaccines is not only do I not want you to get COVID, the vaccine is most important for keeping you out of the hospital, keeping you from seriously getting ill. But it looks like, has at least some decent protection against long COVID, and getting as we keep the vaccine up to date, having that protection, not letting the virus really settle deep into your body. If you've got the antibodies that can fight off Omicron, that can fight off everything in the way that it's changed better, it does look like it's less likely overall that we see people get long COVID. And there is so much we don't understand about long COVID. And we have a lot of people who are still very much suffering effects from that. So for me, staying up to date with vaccine is also helping protect people against the still not very well understood but big deal long COVID. D.S. Sanders on Facebook is asking, is there a set time period in between multiple infections? No, there's not. But let me kind of tell you how I think about that. So the biggest, I think, question mostly around COVID is how seasonal is it going to turn out to be? Is COVID going to settle in like flu has settled in, where we know when the flu season is in the United States? In the Northern Hemisphere. We know when the flu season is in the Southern Hemisphere. The flu season is the cold period. It's when people gather inside, for decades and decades. We know about when flu is going to hit. We can guess about when it's going to peak, and we know about when it's going to end. We therefore are able to make and update a vaccine every fall ahead of what we know to be that year's flu season. And we look at the Southern Hemisphere that has the opposite seasons to make the good flu vaccine for our flu season. COVID seems to have some seasonality to it, but it also continues to sort of sometimes have surges at times that are less seasonal. Here in Chicago, we very clearly have 4 seasons, and we have very clearly seen our worst COVID, during the respiratory virus season. So clearly, in my opinion, there is some respiratory component to it. Some seasonal component to it. But if you look in parts of the world that don't have the 4 seasons, there doesn't seem to be as much of this pattern, and then there still seems to be enough spread that seasonality doesn't hold true. So one thing is if somebody has, like with flu, if somebody gets flu, I can pretty much say you're not going to get the flu in July or August. You're just not going to get it. Like you could get it in October, you could get it in March, but there's sort of this time period. That's not true for COVID from a seasonality perspective. And in terms of the recurrent infections, the data continues to be good that within about the first 3 months or so after getting vaccinated, after recovering from COVID, the chances are lower that you will get another COVID infection, but they are definitely not zero. And that is because of the way the COVID virus has continued to mutate. If everything were still that original COVID virus, we'd be done with COVID at this point, honestly, because the vaccine, very effective against that. The problem is that we continue to see the virus change in the same way the influenza virus continues to change. We have all these strains of influenza, we have all these variants of COVID, and each of those, the change itself, what happens is there's a little change in the spike protein, for example, that lets that version of the virus better evade your immune system. If you've taken the vaccine, your immune system has done its job and produced its own antibodies to fight off the virus. If you've recovered from COVID, you've, the harder way, gotten some of those antibodies to that version of the virus. But if, say, we had the next variant of concern, a new alphabet soup emerge that isn't just XBB whatever, but is Pi or Zeta or a new variant that's different enough, I think it almost wouldn't matter when your most recent infection or vaccine was. So overall, I would say if you just got over COVID last week, you're unlikely to get COVID, this week, next week, in the next few months. If you just had your vaccine last week, the week before, well, it takes a couple weeks for it to kick in, but you get the idea. It'll take some time. Usually about 3 months, we see some levels of protection, but we have seen people get infected easily also within that 3-month period. So I wish I had a hard and fast answer for you, but because the virus keeps evolving, the answer on this also has to keep evolving. C. Davis on Twitter says, do you think you should go to jail for knowingly and illegally quarantining healthy students in Chicago, knowing you are denying them their due process rights? So no, C. Davis, I do not think I should go to jail, and I do not knowingly or illegally quarantine Chicago students, and neither does anybody else. And there is due process in place, and I think you probably know that if you are writing that kind of a question. So just to be extremely clear on this, the requirements right now in Chicago, everywhere, are the same. And I actually went over them quickly. If you have COVID, you must stay home for 5 days. You are then allowed to come out after 5 days if you're feeling better, but you must wear a mask days 6 through 10. That is true in all settings. That's not separate for schools. And that is because that has clearly been shown to limit disease. So no, we are not doing anything illegal around quarantining healthy students. All right. Let's see. Scott Schaefer from Facebook. Are the bivalent boosters protective against this new XBB? How do we know? Oh, very good question. So first of all, there is no such thing as a 100% protective vaccine. And certainly every time there's a new variant or subvariant, that is one of our biggest worries. But every time there is a new variant or subvariant, right away, the scientists are going and checking that new variant or subvariant against all the vaccines, not just the ones that are out today, but the ones that are kind of in the hopper and being tested in case we needed them in the future. They also test them against the medications, against Paxlovid, against remdesivir, and against those monoclonal antibodies. That's how we know that the monoclonal antibodies that we were using for a year, 2 years for immunocompromised people, that's how we know they don't work very well anymore. So the bivalent boosters, luckily, do continue to show good protection, especially against severe illness, based on everything we have now, including against the new XBB. But they're not 100% protective. But we know because that testing is absolutely done. And for me, the number one thing that would get something labeled a variant of concern is if we were to see that the vaccine really was not protective against severe illness. We do see with each of these new subsequent subvariants, usually a little bit lower level of kind of antibody response. There's something called neutralizing antibodies that we can check. And so, every time it changes, that's the virus, trying to outsmart the things humans are putting up against it. But the good news is that I worry if at this point, everything out there, I hear somebody has COVID, which I hear a lot these days. My number one thought is, are they up to date with their vaccines? If they're up to date with their vaccines, meaning they had their bivalent booster, I'm really not very worried that they're going to get seriously ill. And then if they're older or having immunocompromise, I want them to get that Paxlovid. If they do those two things together, the chances of severe illness, thankfully, remain really low. And the reason 2023 doesn't look anything like 2020 is because we have those tools. It would be nice to not have 5% of our hospital beds taken up with COVID and hundreds of Chicagoans still getting sick. But we are able to protect against that, especially at a population level, using those tools. Lisa from Facebook, what's your New Year's resolution, Dr. Arwady? A final end to COVID-19, maybe. So I don't really think we're going to see a, quote, final end to COVID-19. This virus, I think, is likely to be with us in the way that we got out of the 1918 flu pandemic, but we certainly didn't get out of flu, and that flu in particular being something that we continue to see on an annual basis. I certainly, if you want to be honest, my biggest hope is that we don't have to talk so much about COVID. Already, I am so much less worried about COVID-19 than I was at any point in 2020, especially before vaccines were available. And I know that we have tools that we did not have before, and that it doesn't need to be top of mind. And you know, keeping it there certainly remains a goal and a resolution for me and for the department. But you know, when I actually did answer this, one of our local media groups was doing a, you know, what's your wish for Chicago in 2023? And I actually said my hope is that really as a city, we talk about mental health. We talk about mental health as it relates to COVID and the isolation that's come with it, the emergence of, you know, all the ways that things have changed, that we talk about mental health in a way that helps decrease stigma. I really mean that because we've launched at CDPH, we've launched this campaign called Unspoken, which is about recognizing that mental health is health. Physical health, mental health, these are both health concerns. And there's a lot of people out there who will talk ad nauseum about their various physical health concerns, but are really ashamed of talking about their mental health challenges. And while we have people still ashamed about talking about mental health, it means that people here in Chicago or across the country don't get the care that they need, because there is care, there is treatment available, there's evidence behind it, and that's everything from, you know, therapy to medications, especially for people with more severe mental illnesses, schizophrenia, bipolar disorder. There's amazing medications available that we simply didn't have 30 and 40 years ago. And, you know, it's amazing to me to look back at the 1970s. It wasn't that long ago. Nobody talked about cancer. Cancer was like this disease that, you know, you would just say that somebody died of a long illness. We didn't talk about it. There was a lot of stigma around it. HIV certainly still has stigma around it, but we talk about it. We focus, you know, we've really tried to say this is something that is preventable and treatable. There's still a long way to go. But mental health to me sort of feels like cancer did back 50 years ago, where there's this sense that people don't want to talk about their struggles. And unfortunately, after tragedies, after suicides, for example, is when we tend to start talking a little bit more about mental health. I want us talking about this all the time, not just after a suicide, not just after a tragedy. There are resources available. I'm really proud of the work that CDPH has done, although there's a lot to do still. We've built up a true safety net mental health system here in this city. And you know, we'll probably do some more about this on Facebook Live. A reminder that if you want to put comments or questions in about things you'd like us to cover here, because you know, my wish is that we sort of put COVID on the back burner. Don't worry, we're not going to take our eye off the ball, but my team is spending a lot more energy on a lot of the indirect effects that the pandemic has had, and I think the hope is that that will be a major focus. So just a reminder, you know, coming out of New Year's, if you didn't hear this at the beginning, it's okay to not be okay during the holidays. You can go to mentalhealth.chicago.gov to find resources. You can always call 311 if you don't know where to go. 988 is the new national hotline for mental health crisis. If you have thoughts of suicide, if you know somebody who really seems unwell, you can call and get a live person who can help talk to you. Or if you want to talk to someone right here in Chicago, the NAMI helpline, 1-833-626-4244. Okay. We are basically at time. The Family Vaccine Clinic this weekend is at Malcolm X College. It's from 9 a.m. to 2 p.m. You can go to chicago.gov/COVAX or give us a call to register, but you don't have to register. We'll take anybody 6 months and up. We'll get you up to date with flu. We'll get you up to date with COVID, or of course you can register for at home. And I'm seeing a couple people here wondering about, you know, a few other issues, so we will definitely bring those up. Keep putting those in as you have thoughts. Someone's wondering about what is happening with Ebola. We'll talk about that next week because we're in a good place there. So with that, I want to wish you a happy and healthy 2023, and we will be back at our regular time next Tuesday at 11. Even through the week, feel free to just shoot us an email or text or put something on one of our social pages if there are topics you'd like to hear some more about. And I can guarantee you that mental health, substance use, violence prevention, those are topics that we will be using this space to talk more about, even while we also are continuing to highlight what's happening in the infectious disease space. Happy New Year. Bye-bye.